Hey, everybody. Real quick before we jump into today's episode, I have been advised by my attorneys to remind you all that none of what you might hear in today or any other episode of Grow Money Business is financial, investing, tax, legal, fitness, or even relationship advice. It's content that you're free to use and deploy on your own terms. And before you take any actions on what we might cover in the show, I really encourage you to consult with your accountant, attorney, or financial planner. If you don't have a financial planner and think that you might need one, be sure to check out threeoakswealth.com to learn more about my firm's planning, advice, and investment services. Sailee, thank you for joining us on the podcast. I'm very excited to have you here with us today.
I'm glad to be here.
So this is a podcast that focuses on financial planning, financial issues for business owners predominantly. And one of the topics that comes up a lot in conversations that I have with business owners and really any of our clients, even if they don't own a business, is the cost of healthcare. And I'm really excited to have you on to just share your perspective on why the cost of healthcare here in the United States is so high compared to per capita spending in other countries, and just share your perspective on what's going on in the system and what we can do to improve it. So thank you for lending a little bit of time and wisdom and expertise. Is it okay if you shared a little bit about yourself before we get started here, your background and what you do for a living?
Yeah, definitely. So I'm a doctor and a researcher, and if I have to just sum it up quickly, then most of my research revolves around trying to improve patient health outcomes, and that includes, trying to improve quality of care, quality of treatments that you receive, but also improving access of healthcare. And I think, this the question of healthcare cost is like such a major deal in terms of access to healthcare. So yeah, I'm glad we're really talking about this.
So your focus is on improving patient outcomes. Is that at the micro level? Is that at the macro level? What do you do on a day-to-day basis?
Yeah, definitely. So when working with patients or hospitals, we're trying to improve the process flow, trying to see how we can make quick fixes in terms of, let's say, there are like 40 patients who are receiving similar treatments. Some of them really have good outcomes, lower amount of infections. Other part of patients will have higher infection rates or higher readmission rates. So what can we do for their specific situation or their specific economic situation to improve those outcomes, reduce the complications? So that's kind of something I do on the daily basis. On the macro levels, I would say, making policy recommendations as to how healthcare costs can be reduced, or what kind of smaller changes, what kind of low hanging fruits we can target in order to reduce the healthcare costs.
So what organization do you work for or work with? Are you self-employed? What outfit provides that scope of work?
Yeah, so I'm generally self-employed for the most part, and I work with the healthcare startups primarily, to because in the past couple of years I've realized healthcare startups have been doing such great amount of work and targeting really the pain points rather than just beating around the bush and talking, let's do this, let's do that. They've been targeting specific areas of improvement for patients. So I generally act as a consultant or an advisor to them, and trying to improve patient lives with their products. Yeah.
I see. Okay. And so you're a medical doctor, and you have is it a master's in public health from Harvard? Is that right?
Yeah, that's right.
So you've been on really both sides of this equation, and working as a consultant more recently to healthcare startups who are trying to solve some of these issues. They come to somebody like you that has expertise, saying, "This is the problem we're looking to solve," and you're helping them develop their product to make sure that the problem is actually being solved appropriately.
Right. Right. I mean, I've been studying these problems for such a long time, uh, on different levels, and again for different situations, different geographies, for developing countries and developed countries, which really gives me that broader perspective to see how comparing apples to oranges, comparing apples to apples at the same time. Yeah.
So how has that experience as a consultant gone? Do you have a lot of healthcare startups really actively seeking your services? Is it hard to find work in that field? What is your experience been like?
Yeah. So far, it's been really amazing. I it's when I think about it, it feels like these are such obvious things. These are such obvious questions that most of us get, but come to think of it, there's not much research, there's not much study going into this. A lot of, we say there's a lot of research and innovation that goes on in the US, but a lot of that is really focused on on the technical innovation part, but we're not so focused on or there's not much that has been done on the procedure level research or ground level research as to what factors need to be tweaked in order to make healthcare better. So and since I've really been working on that side of healthcare for a very long time, there is actually a lot of demand in this, and more people, more and more companies or organizations, whether it's private or public or government funded, more and more of them are actually interested in using this expertise now.
Interesting. So, from your perspective, why is it so expensive to obtain healthcare here in the U.S.? Why do my premiums go up by so much each year?
Oh yes, that's a very good question. Um, I guess by now we all know that U.S. Among the developed countries is the one with highest amount of expenditure, highest amount of healthcare expenditure. We spend like around 17% of our GDP each year on healthcare expenses, which is way more than most of the OECD countries. The normal average is like 8.5% of their GDP. Even the second one after us, Switzerland, is like 12%, and we are at 17%. So yeah, we are way beyond the normal amount of expenditure that should be happen. And the worst part is it's not really bringing out any better outcomes. So it's not like, since we are spending so much money or our healthcare is so expensive, we're getting better treatments or better access to health, or our outcomes are better. But I think it's a complicated question, and there are many factors to it. Our hospital modalities, our treatments are really expensive. The procedures are really expensive. Our drug prices are really higher. It's way higher than a lot of developed countries. Again, we don't really have a cap on the drug prices, or a lot of procedure prices, hospital costs. They're not capped as they are in many developed countries. The other thing is there's a lot of administrative cost. A lot of waste in that area. So much money has been spent on the administrative cost here in the US. Similar amount of money, most of the developed countries, the same amount of money they're putting into preventive care, which is actually improving the healthcare outcomes. So just to say, if we could reduce our administrative cost even by 25% and put that money into preventive health, we are going to save so much for us, in terms of money as well as improved outcomes for our patients. And of course, other than that, a lot of higher cost of medical devices, um, consolidation of hospital systems. Now again, that's a very complicated and complex scenario, but what that kind of does is reduces the competition in the marketplace, gives lesser choice to the patients in terms of um, you know shopping for uh, accessible healthcare services and inexpensive services at the same time. So yeah, these are like just the crux of you know the reasons for why our healthcare costs are so higher. And just like any other fiscal calculation, the expenditure depends on the number of commodities that you use and the cost of it, right? So for healthcare, it's similar, the utilization of healthcare services and the cost of these. For a very long time, it has been said that just because US is utilizing a lot of healthcare, we're doing a lot of procedures, we're doing a lot of tests, that is the reason that the healthcare costs are high. That definitely does add up to the cost. Oh, a lot of times we are a little more alarmist and go for more services, more procedures, more tests. That is true, but if you look at a lot of other developed countries which would prescribe or which would conduct similar amount of utilization, similar amount of tests, but still have lower healthcare expenditure. So I think the other part that we mentioned, cost of these services, that is what is the area that we should focus on. Yeah.
So we've got a couple different angles here. One of them is the amount being allocated, or maybe the lack of funding going toward preventive care, which would then reduce a lot of the downstream cost. And then another one of the angles is we pay a ton for administrative cost of healthcare, and then the cost of the services themselves, the surgeries, the procedures, the testing, all of the above, are very high in and of themselves. And then maybe a fourth one being consolidation of hospitals, giving consumers fewer choices to and less bargaining power as they're shopping for services.
Right.
Is that a fair summary so far?
Yeah, definitely. It's pretty comprehensively put. And I'd just like to add, higher drug prices as well, because that takes up like a major chunk of our healthcare expenditure, whether it's from the government side or you and I paying out of pocket or in our premiums.
Yeah. So there are two things that have been on 2 points related to those 4 factors that you just shared with us that have been on my mind for quite some time. One of them is this concept of maybe personal responsibility and our own preventive care. I mean, our obesity rates in the US are very, very high. We like to eat what we want when we want it. We don't want to exercise, and we like to kind of rely on the system to take care of us as opposed to taking some personal responsibility. And I'll probably misquote you, but one of your points earlier was that if we just took a little bit of the amount that we're spending toward the high administration costs and devoted that to preventive care, that would just reduce the aggregate costs by a substantial amount. Is that a fair observation, do you think? Are we just fat, lazy Americans who need to take better care of ourselves? Or, I mean, how do all these pieces fit together?
Yeah. So I, every bit counts towards the cost. That is true. So the more we take care of ourselves, we would be in a better physical, mental shape, and of course, lesser amount of treatments, lesser amount of chronic illness, so lesser amount of healthcare expenditure. That's pretty straightforward. But of course, I think the point that we mentioned, lack of preventive care. Of course, there is a lot of preventive healthcare services here in the US, but slightly lesser focus on that, slightly secondary priority to it. Focusing a little more on the preventive health part will actually also focus on this, whether it's obesity or lifestyle changes. These all kind of fall under the same umbrella of preventive health. So let's say if I am 150 pounds and I want to make changes in my lifestyle, my diet, but I don't really have an access to the right medical advice or the right services, to make that change. So it doesn't matter if I want to do it. I should have access to those sort of services, and it should be inexpensive. It should be affordable for me. So if my insurance tells me that it's not going to be covered for me, and I could spend my entire paycheck on getting advice about how to change my lifestyle, I'd much rather stay the way I am, right?
Right. Yeah. I definitely get that. Change is hard, and it's hard to convince people to make that change just for the sole purpose of reducing the cost of healthcare for everybody. You have to see some direct personal benefit to, watching your diet or exercising more or whatever, the stopping
But
smoking
yeah,
or whatever.
we do as Americans really need to focus a little more on our health, taking more responsibility for it. The healthcare cost and expenditure aside, we do need to take more responsibility of our own health. That's true.
So the second point that's been on my mind a lot is this. I'm as I'm a real big proponent of free market capitalism for the most part. I think that the markets are a much more efficient and direct way to allocate resources in a lot of circumstances. But I really struggle with whether we as a country should be applying that kind of system to our healthcare. Because I think a growing number of people are realizing that, you watch TV for any more than like 20 minutes and you'll see a commercial for a pharmaceutical ad. And this whole idea that healthcare, whether it's pharmaceutical or primary care or whatever it is, should fall under this capitalistic structure where an executive's job is to drive profitability for the shareholders. They have a fiduciary responsibility to drive up the revenues where they can and reduce cost to put more money in their own and their shareholders' pockets. That concept, as good as that system, in my opinion, is at allocating resources, really conflicts with this concept that healthcare should be a large part of our social safety net, where everybody should have access to adequate care and information that you just described that relates to preventive care. It seems like those two things really conflict here. What are your thoughts on how all that fits together in our current system?
Yeah, definitely. It's actually a great question because I think for a very long time uh, we have been avoiding this question by just deflecting the whole debate to a capitalistic versus a socialist healthcare system or a country. But I think how we improve our healthcare, or whether we have universal health system, whether we have better services for the patients, it's got nothing to do with actually being a capitalist country or a capitalist system. Because you see, there's a lot of data about this. Most capitalist countries, in fact, us kind of falls around number 10 or 12 in most records of highest or most capitalist countries. And all the countries, all developed or capitalist countries above us actually have universal health system. So a universal health system or accessible health system is not very socialist for them, the countries that are way more capitalist than us, but it is for us. So I find this whole argument a little deflecting, because the issues are if you can focus on specific points, if you can focus on specifically reducing x cost, y cost, that doesn't change the fact, or that doesn't make us any less or more capitalist. It just helps patients and our public. So that's about it. So if we could do simple things, putting caps on drug prices or hospital cost, reduce the administrative cost, make healthcare services or their provisions, their costs a little more transparent to the public, that itself will solve a lot of our problems. These are just low hanging fruits. And it absolutely does not concern whether we are capitalist or nationalist. Absolutely not. Yeah.
Yeah, I totally agree. And it's such a politicized thing these days where, as soon as you hear the words universal healthcare, you immediately think of Medicare for all, because that's how it's been branded by Republicans. And as much as I dislike getting political on the show, that's not necessarily a bad thing. It doesn't mean that you have to run out and go vote for Bernie Sanders and forgive student debt across the board and do all these other really leftist kind of things. It's not that so. It's not that so. It's not socialistic at all. All it is applying more regulatory oversight over the way that we get healthcare as a country and as individuals. And to your point, the other most capitalistic countries that are paying a lot less in health for healthcare than we are have already done this. Is it as simple as putting caps on the price for certain drugs and procedures and so forth, or does it go beyond that?
Well, you're right. It's not as simple as that. But like I said, you can start by going for the low hanging fruits. Of course, you cannot overhaul the entire healthcare system, in 6 months or a year. That is going to take time. And besides, to be honest, you don't have to overhaul the entire healthcare system. We've got a pretty good health system, I would say. There are problems that we could correct. There are things that we could remedy, and that itself could make a lot of things better. So yeah, and I think most of the solutions that you and I just spoke about, just going a little bit on the political side again, they're really more moderate. To be honest, they're no brainer. They're moderate. I think both sides of the aisle should be okay with it. Yeah.
Yeah, yeah, I concur. It's not far on on either end of the spectrum, but I guess we're just in a climate where people on the right can't work with people on the left, people on the left can't work with people on the right, and it's just kind of where we're at.
Yeah.
Um, so let me ask you this: if you were appointed to be the healthcare czar tomorrow, what would some immediate policies be that you put into place?
Yeah. So I think first and foremost, I would go for the drug prices, because most developed countries, and every time I say this, I do mention developed countries because we do want to compare apples with apples, not apples with oranges. uh, Most capitalist and developed countries actually have a cap on the kind of money that's paid for drugs, or how much cost per drug can be increased every now and then. And that's the reason most of them end up paying like 20 to 30% less for drugs as compared to us. So I think that's one of the first and foremost things that I would do. The other thing is improving cost transparency. That is something that can be done fairly quickly. Hospitals, providers, insurance companies having to be transparent to the consumers and the patients, and giving out what prices have been negotiated, or what are the costs for the specific procedures or treatments they are providing. As long as that can be done, patients, one, they can see how much, they can see upfront how much they might end up paying. So you have a very good idea of the financial aspect of it. And two, you have the choice. You can shop around, and you know sh- for some reason it's always said, being able to shop around is not such a good thing. I don't see why not. So yeah, these are the first few things that I do. Of course, there's a long bucket list of things I'd like to do, but these are the I do this on the first day.
Well, that I mean, we're talking about people thinking that putting caps on the price of healthcare, having universal healthcare as part of our social safety net would be dramatically toward a more socialist environment. Being able to shop for services and choose the provider in a market-based system is the most capitalistic thing you can do. And I mean, transparency seems to me to be a huge part of that. Just knowing what your end costs might look like before you sign up for a plan during open enrollment every year. The other thing, though, it seems to me is complexity is a real problem too. I mean, I'm a financial professional, and healthcare is not my core area of expertise, but I'm pretty well versed in a fairly broad spectrum of financial stuff, and healthcare costs still just confuse the heck out of me. And I think a lot of people around the country have a similar experience. Why is it so complex, and what can we do to make that a little bit more easily understandable?
Well, to be honest, there isn't much we can do from our side other than educating ourselves a little more about what treatments we are going to get, what providers we are going to, what does our insurance company offer in terms of this, or what do other payers offer in terms of this. Because trying to understand the entire system of payments is is extremely complicated. I could give you a, like a broad explanation of, hey, this is fee for service, this is capitation, this is bundle payment, but that's just like the most simplified form of it. Beyond that, it is so much more complicated. Most contracts that are negotiated are actually secret. It's there, most payers or providers would not come out and say, hey, this is what we negotiated. These are kind of secret sources for most of them, so it's really hard to say, how we can, or as an individual, how you and I can actually make a difference in that. Also, what happens is, how much a hospital or how much a provider can charge, how much an insurance company, a payer pays. These are really complicated things. It depends on what's the Medicare load for that hospital, what is the market share for that provider, what is the payer, the insurance company willing to pay. Is it a private insurance, or is it a employer based insurance? So, like, too many factors there, honestly.
Hmm.
Yeah.
Could you maybe shed a little bit of light on what that negotiation process looks like and how that impacts the cost of premiums on a year-to-year basis? And I suspect that, like my family, we have a Blue Cross Blue Shield plan, and every year it goes up by what seems to me to be just a massive amount. And I suspect that Blue Cross Blue Shield is negotiating with the different service providers that I can choose as in-network people to work with, and that is the basis for how they're pricing the premiums to the end policyholder. What does that? And I understand that it's very complex. There's no simplistic answer to this. But what does that negotiation looks like? Because it just seems like the experience is that you're just stuck paying the premium. You have no recourse.
Yeah, definitely. So I think, again, like you said, it is pretty complex, but some factors, like if your payer is trying to get hold of as many providers as possible, some of them might be in your network, some of them might be out of your network. Your payer might have lesser leverage to certain providers versus might have a lot more leverage to some of the other providers, some of the other hospitals, where they might be able to get comparatively inexpensive cost or inexpensive negotiations done there. Um, the other thing being, like I said, that specific hospital or that specific provider, what is their distribution of their patient population? How many Medicare, Medicaid patients they're doing versus how many privately insured patients. Because more often than not, providers or hospitals end up charging the private insurers more to cover up for what they lose with Medicare costs. Um, Private insurances would generally pay at least like 50 to 60% more for any given service or any given treatment as compared to Medicare. So the hospitals and the providers, the money that they lose by treating these patients, that is kind of covered from your insurances. So yeah, I think those couple of factors together will decide how much your insurance company really charges you. But again, no one really tells you what exact calculation was made, because that's like a super super secret thing.
Right, right. I'm sure it has to do with preserving a certain profit margin. And so the amount that service providers are reimbursed for by Medicare for taking Medicare patients, is that a fixed amount? I suspect as a huge purchaser of services that they just have a massive amount of leverage. And if you're an operator and you're trying to figure out how to get patients in the door, you can go that route at a lower benefit to you. Is that accurate?
Yeah. So Medicare, how much Medicare pays for similar services or similar treatments actually varies a lot across different states as well. And again, it is fairly complex. There's a lot of conversion factors, so physician conversion factors, hospital conversion factors, the economic conversion factors, depending on that state or that specific healthcare facility. And a lot of healthcare costs are actually calculated based on these factors. So it could vary state to state, city to city, hospital to hospital, and patient to patient. Yeah.
Interesting. Um, can we go back to the idea of administrative costs being so high in the U.S. relative to other countries? Why why is that the case? I understand pharmaceuticals, I understand cost of labs and all that. Why is administration so much more costly here?
Yeah, sure. That's actually, there's a trickle down effect of most of these other factors that you mentioned. So when it's difficult to calculate how much X patient is going to be charged versus Y patient is going to be charged for the exact same treatments, exact same number of days of hospital stay. When it is that difficult, then the amount of time that you have to put into the administrative work or the clerical work for X patient and Y patient are going to be really higher as compared to, hey, this is the cost for this treatment, or this is how much every patient who goes through this sort of situation is going to be charged. uh, so that kind of reduces a lot of administrative time in itself. And again, I'm trying to explain it in a very simplistic form. Of course, hospital systems, providers, and payers are like these huge conglomerates, so it's really difficult to pinpoint one specific example, but that's what I tried to do. The other thing being, the payment systems in itself are so complex, like you and I discussed, that to be able to maneuver around that, you need to hire professionals who are, well versed in these complicated systems, which means, you're going to put more money in administrative human resource, the amount of money that you're going to pay these people, the amount of technology that you're going to need, for these sort of complicated procedures. So I guess, yeah, that kind of just adds to the administrative cost. The other thing also being, uh, process flow, in the sense, just take the COVID example. So when COVID hit, there was a lot, so much technology, so much innovation going on at that point. But what we eventually lacked at the initial point was beds and ventilators, something as simple as that. And that did not need innovation. That was so ventilators have been used in hospitals for about 100 years. Beds are just beds. So these simpler things, but the problem was, in the logistics of the hospital management, or in the supply chain, or the process flow. So these are the smaller areas which, any amount of waste in that will actually increase the administrative cost. Yeah.
Sure, sure. So if we were to compare the US to some of these other developed, very capitalistic countries, on a more apples to apples basis, because some of the other countries have applied stricter regulatory controls over pricing and maybe providing a more nationalized system, you only have to operate one system. It's just much less complexity, which allows you to deliver the administrative side of it for a lot lower cost. Is that is that accurate? Do you think?
That's true to a huge extent, but of course I'd still say, there are developed countries where, um, the health insurance or the health system is not just single payer based. It is universal. The government chips in for your insurance. The government makes sure everyone is insured, whether you can afford it or not, and try to do as much as possible from their side. But not all of them will have, like, single payer system. A lot of times there's a very good mix of public and private insurances. But I think, for some reason, over the years we have complicated it so much here in the US that undoing it is actually going to take us years. Like we just spoke about for so long, that the payment systems are just maneuvering around the healthcare system is so complicated that that is what actually makes it difficult as compared to a lot of other countries, rather than just, having a single payer system. Of course, there are many upsides to having the single payer system, and that's definitely a discussion for another day. But uh, But you're right, it does matter a lot.
One of the other things I wanted to ask you about here, real briefly, we work with a lot of physicians and people in the medical community at the financial planning firm, and burnout is something that I think every single one of them battles and faces kind of throughout their career. And the typical experience is you go to college, you go to medical school, you have your residency, and you're an attending physician, maybe around 30, early 30s, something like that. But I don't know. I think I've run into very, very few physicians who truly want to work after age 60. And the whole system is just churning and burning physicians left and right. What are your thoughts on that issue? And is it related to what we're talking about here and the complexity and cost? Are these two things related?
Yes, absolutely. This is a very good question because it is actually related uh, to a huge extent. So, so look at it this way. Right now, we're spending so much money, but the access to healthcare for the patients is less. We have lesser number of doctors for a higher number of patients per thousand patients. We have 8 or 9 doctors for per thousand patients here in the US, as compared to other developed countries where you would have many more doctors per thousand patients. So every doctor is responsible for so many more patients here. So just looking at the number of hours that you would have to give to be able to cater to your patients in itself is going to be higher. The amount of responsibility, the amount of physical work, the amount of mental work increases big time. Then of course, the payment system and administrative work, like we said, is so complex, so complicated. Just like you and me, the doctor is going to have a hard time getting around that. The doctor has been trained in medicine, not so much in going around these administrative things, right? So it's going to be really tiring. That's one thing. The other thing being, and this might be a little irrelevant, but I do think it still fits in. The cost of our medical education is really, really high. So what happens is you come out of medical school with a lot of debt. So people are opting more for specialities, of course, out of choice, but also because medical specialities, as compared to being a family medicine physician, would probably pay you a little more because you want to pay out your debts, right? So we don't have as many family physicians or internists at this moment as compared to other countries. In most countries you would have more general physicians and lesser number of specialists, which is a good mix to have. Here in the US, you have a lot of, a higher number of specialists as compared to general physicians, which also increases the cost of our healthcare because, the patients would probably be visiting a specialist for something they probably don't need to. They could have gone to a general physician, but because we have so many more specialists, so that also increases the healthcare cost. And at the same time, it again brings us back to the same thing: lesser number of doctors catering to more number of patients. So all these things together are actually going to cause physician burnout. Yeah.
Yeah, that's it. That's very interesting. I never put it together myself in those terms.
And I personally think, as a clinician, I've seen this because when your patients suffer because of these complexities, that itself takes a lot of mental toll on you, as a
Oh yeah,
clinician. So that also adds to the burnout.
right, right. So So what's next for you in your career? This has really been enlightening from my perspective. Right now, you're consulting with healthcare startups who are trying to solve some of these problems in various capacities. What are you working on over the next year or two, or maybe the next 5 or 10 years of your career?
Yeah. So one is I do want to see more and more organizations, more and more companies, whether it's public, private, for profit, non-profit, coming out with better products, better services. And if I can help any amount of patients with my expertise, my research, if I can make these services better for them, that's what I'm trying to do. The other thing is, of course, on policy levels, if we can push for better changes, again, even if we can go for the lower hanging fruits, change doesn't happen right away. You really have to be very patient. So if I can get anything done from my side, any changes on the policy levels that we can focus on, I'd really be happy to do that.
How do you plan to go about enacting policy change?
I think a lot of advocacy work, working with different organizations that have some impact on the policy decisions that are made, the government and on the political side. I I really like kind of like working with them because I think my recommendations or my suggestions are taken to a next level because they are infused into the policy faster that way.
Right, right. And I suspect now you're in Boston. I suspect there's a lot of that activity
Oh yes,
right in your back door, right? So
a lot of that.
you have access. Great. Well, what did we miss, Sailee? What should people out there consider when evaluating their own healthcare costs?
What I'd just like to say, educating more about what affects the healthcare cost will actually help you make better decisions. Because, like we spoke for the last 1 hour, everything is really complicated. And the more you can, break it into pieces and understand what applies to you and what you can do from your side, it's going to be better. So educating yourself more about these things is the first step. I'd really suggest we do that.
That is an excellent and wise piece of advice. Well, thank you for coming on. I really did enjoy this conversation. It was a little bit of a departure from a lot of the core stuff that we talk about on the podcast, but it was very enlightening, and I appreciate you joining us. Do you have social media or a blog or anything you'd like to promote yourself?
So if anyone wants to reach out to me, they can reach out through LinkedIn, Twitter, Facebook. I don't really have any blogs. To be honest, I'm not that socially active. I'm not that active on social media. But yeah, I'm always happy to answer any questions, help out whenever possible. So feel free to reach out to me whenever you want.
Wonderful. Well, thanks again.
Nice to be with you.
Thanks for tuning in to Grow Money Business, the podcast dedicated to helping business owners grow both their wealth and business on their own terms. Be sure to subscribe to the podcast on iTunes, Google Play, or wherever you digest podcasts to ensure you don't miss out on future episodes and announcements. And feel free to submit questions to growmoneybusiness.com.